Hello everyone, welcome to my channel again. My name is Rolake. I'm a registered nurse. To my returning subscribers, I welcome you to my channel again and thank you for subscribing to my channel. And if you are viewing me for the first time today, I also welcome you to my channel and don't forget to subscribe to my channel. Today I'm going to talk about how to prevent vaginal tearing during labor or any other genital organs tearing during labor. Please don't go away. Come along with me. Let's dive into this topic together. What are the causes of vaginal tearing during labor or any genital tract tearing during labor? Number one is having your baby for the first time, having a big baby, shoulder dystocia, when the baby shoulder stuck behind the pubic bone, advanced maternal age, when the woman is having her first child when she is more than 35 years of age. There's going to be rigidity of the perineal site. This can prone the woman to have any genital tract tearing during labor. Another thing is gaining excessive weight during pregnancy, delay second stage of labor, sudden pushing at the second stage of labor, pushing a gaze on fully dilated cervix, not listening to the advice and the instruction of your midwives or obstetric and gynecology during the second stage of labor. These are all the factors that can predispose a woman to experience vaginal tearing or cervical tearing during labor. Here are the areas that the tearing can occur during labor. Number one is the perineal. That is the area of the skin between the vagina and the anus. That part is a perineal and is a commonly place that tearing actually occur during labor. Another part is the vagina, the cervix or pelvic muscle floor. It depends on the extent of the tearing. How to prevent vaginal tearing or any other genital tract tearing during labor? Number one is proper hydration. Hydrate yourself very well during pregnancy. Hydration improves skin integrity and allow the skin to stretch out, most especially the perineal. When the head of the baby is crowned during labor, the perineal will stretch out to accommodate the baby. If a woman is well hydrated, it's going to improve the integrity of the skin and allow it to stretch out during the second stage of labor. Another thing is to improve your healthy eating during labor. Ensure that your meal, your food include vitamin C and E, which actually improve skin health and integrity. And make sure you take it in moderation. Anything you are taking, let it be in moderation as well. Vitamin C, E, and zinc actually promote skin integrity, which allow the stretching of the skin during labor. Another thing is to engage in an exercise. If there is not any contraindication, another thing you can do is also to lubricate the perineal, the area during pregnancy at 35 weeks of gestation upward by lubricate with oil like almond oil or olive oil. Lubricate the perineal area, the area between the vagina and the anus in a circular form in order to promote blood supply to that area, which improve the skin integrity and also allow it to stretch out during the delivery of your baby. This is important. Another thing is to listen to the instruction of your health care provider. They are the one monitoring you, even though you are the one doing the work, the bulk of the work. But when they are instructing you not to push, because you can't push a gaze on fully dilated cervix, or when the baby head is not crowned, when the baby is not yet to come, you must listen to the instruction. Avoid pushing a gaze on dilated cervix, because with that it can actually cause postpartum or intrapartum hemorrhage. Is a thing of never to occur for a woman to have cervical tears that can lead to postpartum or land the woman into an acute setting. So you can prevent this by listening to the instruction of your healthcare provider, of your attending obstetric and gynecologist during labor. Another thing is to have a slow control second stage of labor. At the second stage of labor, you are going to have a stimulation of to bear down, but you have to do this slowly and also to control it by making use of deep breathing to control your pain and control the sudden urge to suddenly push the baby's out at the second stage of labor. Another thing is for the healthcare provider to minimize vaginal examination, because by frequently examining the woman, the vagina can be odematous, which can actually affect the way the area of the perineal or any part of genital tract will be able to stretch during labor. After all this being done, carefully done, there may be a need for episiotomy. It's not a routine procedure in the hospital, but if the need be, by the discretion of your obstetric and gynecology or your midwife, it is better to give episiotomy than allow an unintense tears, because epi will be given neatly and infiltration of anesthesia will be given to reduce or to knock off pain when this episiotomy is given, which is going to be given around in the perineal site. That is the area between the vagina and the anus to accommodate your baby. It's better to have episiotomy than having tears, because tears edge can be irregular and it can be difficult to suture back. But episiotomy is going to be given neatly and the healthcare provider will be able to suture it easily, because to maintain cosmetic of that area is also important. You don't want to have a tears like a rag that everything will just tears around without any form. It will be difficult and the woman can actually lose blood as a result of that than intense episiotomy being given. I'm not advocating this, but it's better than having a tears that can cause postpartum or interpartum hemorrhage. So these are all the ways to prevent tearing during labor. So for every pregnant woman watching me, for everyone watching me, have come to the end of this video. Thank you for staying with me till the end. And for every expectant mother, I wish you happy delivery, healthy babies to healthy family. Until next time, I will be doing another video. Take complete charge of your health. Bye for now.